Okay, PowerPoint 1.3, still week one. So these are basic introductions, but here's the question is, what is a dental implant? Now, I did just kind of explain that in 1.2, but I want to elaborate a little bit more, and I do want to emphasize how important dental implants actually are in full mouth rehabilitation. So that's why we're going the little extra length here to kind of reinforce what we just talked about in 1.2, which was how to communicate what exactly the dental implant is and the three anatomical parts. So this is extremely important to really have this down so you don't sit there and second guess what exactly we're talking about. We're talking about the crown, the body, and the root of a normal tooth. And then we talk about dental implants as basically being the same. So this is what I've already talked about. But let's look at it this way. If we have the dental implant, what exactly do we do? Well, the dental implant is commonly referred to as like the tooth. So this is where things get confusing a little bit. Patients seem to think they're buying a dental implant, which means that they're buying the actual tooth that is what they see, which is the crown. That is not what they're buying when they're buying a dental implant. The dental implant is the root structure or the supportive structure of the prosthetic, which is the crown that's above it. So synthetic root or artificial root replacement would be another way to say this, or root replacement treatment. In our office, we discuss the treatment as a complete service. So we include the body, which is this abutment in this picture here, if you can see this, and the crown and the implant. So we call it full tooth replacement in our office. And here is the bread and butter of what I'm talking about in this 1.3 PowerPoint. The foundation of a crown, that is what the dental implant acts as. And with that foundation, not only can we put a crown, but we can also support a denture. So we can have denture supported by implants, and that could be both removable and fixed. So here are my little example of a crown and a denture are both dental prosthetics. I explain it like, basically like Captain Hook, and Captain Hook has a prosthetic hook, right, instead of a hand. That's what we're talking about in the mouth. People don't commonly think their crowns as prosthetics. That's technically even something more. It's fixed prosthetics. We don't remove the crown. But if you had a partial or a stay plate or something like that, where that crown or that tooth comes in and out, then it's removable and it's non-fixed. So a denture typically is removable, except when you start adding more of a foundation. If you have more implants, you can now fix or stabilize that prosthetic, just like you can with crowns or modified type dentures like hybrids and things. And we'll talk more about that in a later date, but I wanted to just emphasize a little bit more about what the actual implant can actually do for people. So you're going to get these questions, but I just want you to know what exactly a dental implant is and what relative to a tooth. And what can they be used for? And when we talk later about different plans and hybrids and multiple implants, when the cases get more complex, it'll keep re-emphasizing these basic points in these first couple PowerPoints here. And that's about it. Thank you very much.